So this is a very brief case. Now this uh, young 19-year-old male comes to my clinic with complaint of sleeplessness since 3 months. He was just not able to sleep. Uh, he was preparing for his CA. He was a younger brother of a homeopath. And the homeopath was my student at some point of time, and she had brought her brother for treatment. Now, this young man was preparing for his CA exams, accountancy exam, chartered accountancy exams, and was under a lot of stress as he was unable to study due to his sleeplessness and anxiety. So I asked him to describe his anxiety, and he says that I cannot stop thinking. I constantly think about abusive words and or sexual thoughts intrude my mind. I'm unable to stop thinking or control these thoughts. I've started talking to myself. So what kind of OCD this patient has? This patient has sexual OCD. Constantly engaged, right? The same sexual thoughts would repeat again and again. And this was just a 19-year-old male. And he's unable to stop thinking or control these thoughts. And he started talking to himself. While sitting alone, he would constantly talk to himself. So this was the state. And this was a fresh case. This was a fresh case, just a couple of months, 3 months since he developed this symptom. So I asked him on inquiring about the cause, he did not mention anything. Since he was perturbed by constant sexual thoughts, I asked about his sexual life. He was a virgin, so I asked him if he masturbates. He said, I used to till 4 months ago. Now, look at this timeline. He said, I used to masturbate till 4 months ago. Now, and he has this problem since last 3 months. Something is happening here. So I asked him, why did you stop? Now, a 90-year-old male who was regularly masturbating, 4 months ago, he suddenly stopped. So what he tells me is, I have read that this is not the right thing to do. It is harmful and immoral. Our parents do not expect such things from us. And the second thing he mentioned was that once my sister has also found me watching porn, and she also counseled me about how wrong I was doing, so I stopped masturbating. So what had happened was that this young man was watching porn, and his sister actually caught him. And then the sister, being a doctor, she gave him a long lecture about the sin that she was committing, that why it was not something that he should be doing. It's something that it's wrong. It's according to religion, it's wrong. It's something that the parents do not expect him to do. It's immoral. It's unhealthy. So he gets a long lecture, and obviously he feels ashamed also. And then at that point of time, he stops masturbating. So I asked him, did you develop all your complaints like these constant thoughts after that? He says, yes. So you can see now this is, although this is a case of religious OCD, sexual OCD, but you can see a very recent event that has triggered it. So a psychiatric case with a psychiatric cause. Now, what do we do? One, we'll give him a remedy, and another we'll counsel him. I'll tell you about both. What is the primary rubric here? The primary rubric here was that he has committed a crime. He has committed a sin. That was his belief. That was what he told me. He was told that this is a sin. This is a crime. This is something that he's not supposed to do. His parents do not expect him to do. So the primary rubric in this case was that the delusion that he has committed a crime. You can look at the remedies. For me, this was the case. Delusion, imagination, crime committed he had. Thoughts, sexual. You can look at the remedies based on the other symptoms of this case. I cannot show you the video case long here, so I'll just, you'll have to trust what I saw in this case. The remedy that I prescribed to this young man was Calibro. The Calibro has this very strong delusion that the child is, that he has committed a crime. The were some other symptoms also, but what I tend to do in my practice, in a busy practice, we don't usually note down, repertorize all the rubrics. What we do is we repertorize a couple of key rubrics, and we will see from a knowledge of Materia medica and clinical experience which particular out of these 10, 15 remedies fits the case better. I just took these two rubrics and then gave this child the Kali bromatum 30C in water solution daily. But at the same time, when I gave him this remedy, I also told him about male sexuality. I told him about how common it was for men to masturbate, how common it was for, and at what level, at what point it becomes unnatural or unhealthy. I told him that this is something that most young men do. They don't fall sick. Anything in moderation, it's not bad. Medically, it is not proven to be bad in moderation. Only excess of everything is bad. So there was a dose of counseling so that he comes out of that guilt, along with it, the right remedy. So he comes after 2 weeks, and within 2 weeks, he says, I believe it was 2 weeks. I think. Right. Okay, so I believe it was only in 2 weeks, and he says that there are no more sexual thoughts. He is able to sleep. Remember, he came to me for sleeplessness, not for OCD. His primary complaint was sleeplessness. He was able to sleep, and anxiety was less. And so this is a very, very brief, very short case. We deal with much more complex cases. The